Right. Like,
Yeah,
of course they're going to protect their own decision.
exactly.
And like I like at what point did I give away my right to make my own medical decisions? Um, and even that for my baby. And even after, she was born, they told me that she was not even there anymore. I found out, they called me about her hearing test and her passing. They were hiding her from me at the hospital, claiming that she was already gone with CPS, and she wasn't. Why I was paralyzed and immobile and ill, they were hiding her and saying that she was already gone. And come to find out, she was still at the hospital, and I went back to go pick her up.
So you had two other children in foster care at the time of baby Nina's delivery?
Yes, the sole intention of them extending the case was so that they could get access to the baby. I'm sure of it, because they didn't have a reason to extend the case other than they saw that I was far along, and I know that they had planned to get her, and that's that's how I feel. Like they just wanted to take my children and they have a brand new case for the baby, but they used all of my son's supposed allegations and put them in with the baby's case. Um, so they were only using stuff that they stated for the boys in order to get access to the baby, because they didn't have any actual proof of any danger or anything. So they just used their old allegations and used it for the baby. And then what the doctor said about me refusing a C-section, there's nothing wrong with refusing a
There is
C-section.
nothing wrong with refusing a C-section, especially because the risk of maternal death is 3 times higher. That says that they're taking care of the baby for false evidence period and not taking care of you, the person who came to them for help.
Right, and how was I to care for my baby if I lost more than half my blood and needed 2 blood transfusions? I think that's counterproductive to have a C-section if it's unnecessary and unwarranted. And like, I didn't know all the things I was not going to be able to do after the surgery. Like, I couldn't barely walk, I couldn't drive, I couldn't talk, I couldn't eat. Um, there were so many things that, like, I wasn't prepared to be crippled. Like, with natural childbirth, I would have been up and about the next day, wi- within a week or two healed. But for months, I couldn't even swallow food. I could hardly talk. I was so weak. I, I, I just, I couldn't believe it. Um,
Yeah. So I don't see anything about a cervical dilation, which would have been great in your record. If you
it's
would have
in
mentioned
there. I saw it. Let me see. I don't know if it's in mine. I did send you mine and the baby's. Like,
yeah, I saw
it
that.
says 10 centimeters dilated,
Where?
at the procedure part. At the part when they're talking about the procedure. Hold on, let me see if it.
Find it.
Okay, 1 second.
And then tell me what the baby's on.
Okay, here's Nina. Oh, my
Anatomical
mouse isn't.
diaphragm for the foot and the vagina. Okay, I see it. Okay, it says
Okay.
completely dilated. Okay,
Mm-hmm.
check it out. The whole, okay, this is very complicated, and I'm a specialist in breech, so I can say that other doctors do not know what I'm about to say to you, and that is one of the reasons why they possibly could get away with this, because that is considered a working under good faith, or in good faith. What they're doing is they think they're helping, even if they're not. So because they're working in good faith, there's a chance that they could get away with all of this because they don't know better. You know what I'm
I
saying?
I understand what you're saying, but I have an insurance license, and their insurance does not cover if you do not give consent, or especially informed consent. This woman that I refused to the first time, told me how safe and how perfectly fine it is. And I told her, I'm sorry, I'm going to have to get a second opinion, and I'm not willing to go through major surgery for childbirth. I
Yeah,
don't think that that's.
that is very sad that she would say that it's safe to shred someone's abdomen, yet not safe to push out a baby that's basically falling out of you.
Right.
That's crazy. Okay, so the reason why that's significant, and I found it, I want you to circle it if you can, page 13. It says completely dilated, which means that the baby was likely not a footling breech. Not a footling breech, which means that these doctors were incompetent and don't know the definition of a footling breech. Okay? A footling breech means that the cervix is being dilated. Oh, sorry, I'm going to voice me. The cervix is being dilated by the feet, and thus the risk is that the baby's feet could come through without being completely dilated, so that if the body continues to descend with an incompletely dilated cervix, there's a risk of head entrapment that cannot be resolved using positioning of the baby. However, with a completely dilated cervix, that's not a risk.
Wow.
Your baby could have made it through because it wasn't the feet dilating your cervix. It was the baby's butt, and feet were right next to the butt. That's called a complete breech position, not a footling breech position. You know what I'm saying?
Yes, ma'am. And the ultrasound does say that complete. It says complete frank breech position
Where does it say that?
on the July 5th one. I'm still trying to.
Don't worry about it. You're recording it, right? Just go through it later.
Yeah, okay.
Okay. Try and help me find that ultrasound.
I know it's in my chart. Oh. Because I was explaining it to my midwife, so I didn't want her to be caught off guard or anything. So I was telling her, and I sent her a copy of the complete frank breech that was in my chart, and she said that's actually the safest kind of breech.
Yeah, you can't see, and that's the thing. Even midwives don't know that, and that's why I'm saying most people don't get it, because I'm telling you something that I hear constantly wrong 100% of the time, and you're like, well then Victoria, if everyone's wrong, then how are you right? Because let me tell you that the reason why it's dangerous to have a vaginal delivery with a footling breech is that you risk not completely dilating the cervix. But if you are completely dilated, that's not a risk any longer.
That makes sense.
Yeah.
Okay, let's go to July 5th. Chief complaint status, physical exam, assessment and plan. And then it says Alvarez anterior RT something placenta.
Did they do an ultrasound
Frank.
when you came into the hospital for the baby? Did they do an ultrasound, or did they only use their hands to evaluate you?
Well, I went in on July 5th, found out the baby was still breech, and then on July 9th is when I went into labor. But I had been already preparing the birth with Allison, with the midwife, because I was not willing to go through with surgery. But it says Frank Breech RT for July 5th.
What page is that?
This is in my chart. I don't know what page it is on the on.
Okay. Let me see. And you sent it to me, right? So maybe it's here.
I'm pretty sure I sent you everything I could find.
Okay, I don't see a July 5th. I see July 9, and then it go the first
It might be at the very. I might be at the very end instead.
Okay.
Like sometimes they do it backwards. Like sometimes they'll put the first one at the end instead of in the beginning. I'm opening it now. I'm looking. Wait, I'm gonna do Control F.
Um,
July 5.
you're right, it is at the end. I see July 5. Let me see if I can find the ultrasound. It's not the law that you have to have prenatal care either, and I don't know why
And I
they're just saying that you are someone who's disregarding opportunities to find your child in a healthy state. That's what that's about, right?
Right, and I understand that. I have a degree in biology. I took my own blood sugar for Xavier and did my own blood pressure. I did all my own monitoring because I couldn't take off work because I was
That's beautiful. I think that's
subcontractor.
great. That is prenatal care, although how I get that they want it to be by their certified people, but you did a lot of that stuff that they do anyway. You're right. Okay, I see it. There's a Frank Branch presentation. Okay, on my gosh, on 7/5/23. I see it. Okay.
Yes, July 5th. That's correct.
Yeah. So basically, it's proven that your baby is sitting in a position that its hips are flexed. Whether or not it brings its feet down or kicks them up to the head, it's not going to stand on your cervix. So the foot length presentation was incorrect. That was wrong. And the dilation was wrong, like was in support of you being mismanaged, unfortunately. And then I also noticed in the CPS statement from the one that's in the baby's chart. What does it say? It says reason for consult 44 weeks. And I still want to know why they're saying that. If you can find your first ultrasound where it shows the dating
See,
versus your menstrual period, that'll be
that was by a different hospital, so I will have to
go
get
get
there.
it.
Okay,
Yeah,
yeah.
get that. I'm gonna put that on your to-do list. So get the first ultrasound.
Like I'm sure they're incorrect. Like, I know for a fact because um, of who the baby's father is, and I knew it seemed way too weird because I had my period in October. 11 weeks was just way too far along.
Do you remember what the period date was? Your last menstrual period?
I don't remember the end or the beginning, but I know it was around October 26th. I don't remember if
Okay.
that was the beginning date or the end date.
Okay.
And did she ever, like, these other allegations they shed that she had, like the meconium aspiration and
I don't see
treating
that at
her?
all. In her chart doesn't show that. It just says that she had transient tachypnea of the newborn, which is something that is related to the cesarean section, not even related to the vaginal delivery.
I saw that like they're saying that she had meconium aspiration and then some kind of tachycardia or
Fetal tachycardia was because you had an infection. It says you had chorioamnionitis.
right, but they told I don't see anything that says positive for anything, and it said the
Like,
culture.
how did they define that?
Yeah,
That's so
exactly. I think
confusing.
that they were making things up and treating us for things that we didn't have. Um, because I wasn't ever given any antibiotics for any kind of infection. Um, and I don't see
Also,
anywhere where I tested positive for any kind of infection.
right. So that doesn't. So yeah. So say you didn't have chorioamnionitis and they charged insurance for that. That's fraud.
Yep.
Um, also, the oh my gosh, because we're talking over each other, I keep missing. But so for the baby though, they did an exam on the baby when it was first born, dating is incorrect based
Wow.
on the baby's finding at birth. Okay?
Okay. And the oxygen, like, let me go to hers. What I'm looking at on her record, um, hold on, let me get to, that's fine. Some of this is just social work stuff, but it says, okay, discharge to mother against medical advice, and then says meconium aspiration, post-term infant, not heavy for dates, affected by maternal infection.
Because their dating is wrong. That's what I'm saying, is these people are not looking at what they're saying. It's crazy. Your baby wasn't big because it wasn't 44 weeks.
Right. That's exactly how I felt. Like I can't believe the stuff that they're saying doesn't even match with anything that was going on with her, and then how fine she was, and then they were acting like she was sick around me, and they kept her in the NICU and kept her away from me, not because of any medical reason, but just to keep her away from me. I felt.
I thought you were this evil person for some reason. They're all wrong, and they're just propagating information amongst each other. So these X-rays, it doesn't say the date that they were taken, but I do see a reason for study, date of exam 7/10, and this one reason for study. Yeah, I only see those on 7/10. Let me see if there's a study on 7/9, which was when the baby was born. 7/10, I guess, must have been when they did the first X-ray, right? Or the 7/11 is another one. Yes, so 7/10. Okay, so based on the X-rays, all it says is impression, normal lung volumes.
Yep, that's what I.
Retained fluid because it was a C-section baby. No focal consolidations or pleural effusions, pneumothoraces. That means the lungs are normal. They did not have meconium aspiration syndrome.
That's exactly what I was thinking, and then I look and I see stable and room air. Like she didn't need any oxygen.
There's no way that a baby has meconium aspiration syndrome if it's on room air. It's going to be on oxygen nasal cannula for months.
That's.
While its lungs heal. So it is not true.
Yeah, I feel like they were just making up illnesses to.
On your end, but the baby's chart tells the truth. That this baby was healthy and normal and did not have any problems.
They just imply that, I guess, because post-term breech birth, I'm trying to find where it says discharged with mother against medical advice. Like she was actually discharged medically 2 days before me,
and your drug status was negative, right? Like that's
yes.
Never going to be brought up. Okay, good. So it says recertain for consult in Nina's record, 44 weeks post-term baby. What they should have put after that was after that the agent, the CPS agent, should have looked at the medical record of the baby and seen if everything was correct, that baby was redated to probably 40 weeks based on what it looks like. How the baby was how big? 8 pounds?
Yes, 8 pounds, I think. 6.
So it's probably a 41 week baby, normal, okay? And then it says with minimal prenatal care. Who gives a shit? Did you know that there are studies out there right now that show that prenatal care does nothing to change outcomes?
And not just that, it can cause you more stress than anything, because you can have I remember my first pregnancy, they scared me with all these statistics about the possibility of her having whatever genetic, and it gave me nightmares for months. And she was perfectly fine. There was nothing to worry about. They just throw a bunch. I mean, I was so young and uneducated about what I was hearing. I didn't understand. They were just scaring me. And she was perfectly fine and healthy. There's no need for extra anything unless you know something is wrong. If there is a sign of anything that's abnormal. But other than that, you don't need to go overboard and do all this extra stuff if you're perfectly healthy. All you can do is you're going to stress yourself out and worry when there's no reason to be worried.
Right. Let me ask, are you white or Mexican, Hispanic, Native? What's your ethnicity?
I'm white.
You're white, but you're not wealthy looking, right? Like there's probably judgment based on your socioeconomic status.
Yes, I'm sure. Like I'm educated, but I don't have a lot of money. I have a lot. I have a lot of children, and I work a lot, but I don't. You know, I had my first child at 14. So yes, my socioeconomic status isn't. I think that's the number one reason why I'm being targeted is because I'm not married, I'm single, and I'm an easy target for them to. I mean, it's just easy to get away with it because they think that I don't have support or any education, that I'm not going to either stick up for myself or legally be able to do anything because they're, you know, they have all the legal resources that they could ever want or need, and I don't have any. But I can do research myself.
Right, right, and I think that everyone has the right to autonomy, and it seems that they have taken away your right to an autonomous decision. So basically, the baby was healthy. So anything that says that the baby was not healthy was not because of you; it was because of them. And they put in your chart that the baby was 44 weeks without correcting it because they're not double checking other physicians. Okay.
Mm-hmm.
Let me just continue to read that statement because there was something else in there that bothered me. It says, left against medical advice, that should not be held against you. Who cares? Return in active labor and complete another version of, okay, you were doing just fine. If they didn't step in, they should have let you be. Mother continued to refuse a C-section until an OB pleaded for the baby's life. And guess what? That baby's life was not at risk. So that OB was absolutely wrong if they were pleading for the baby's life. That is wrong to say because it wasn't true, and the CPS worker never even questioned this statement. Is it really true? Is the baby's life at risk, or was this OB full of shit because they always are?
Even if somebody is begging for the child's life, like they never checked her. Like, how could you be begging for her life? She's being born. She's not dying. That's what.
Exactly. That's ridiculous. Okay, and then also it does say that there was meconium, but that's because every single breech baby that comes out asks for shit, because that's what they do, and that doesn't mean it's the same as meconium thick amniotic fluid. That's just that the baby was shitting because it was coming down the birth canal, which shows me that that baby was progressing well. But that's only because I deliver breech babies that I know that. They don't know that.
And I thought that, like, if anything was forced into her lungs, it was from them pushing her back in so that they could cut her out.
Exactly, but it didn't even do that. So it didn't even happen at all.
So it's just
so
a
total.
They're just
aspiration.
Because the lungs show that, right? They're like, if there was.
Show that there was no consolidation, which means there was no meconium aspiration.
So they're just making up illnesses, and I'm sure.
On your chart, it's not on her chart.
I'm looking at her chart, and it does say.
Where?
Hold on. I wish. Right here on page 32. 32 out of 74. Meconium aspiration. I don't see the TACA, whatever it was that I saw earlier. Distress due to MAS requiring support HHHF. NC 40%. Continue to wean to room air.
32 here now. Stational age. This is Nina's chart. Nina. Okay. It says abstract notes continued. Stational age. Thank you. Subjective. Where's the plan? I need to see the plan. And Also, the baby was born with awesome Apgar. 599. Oh my God. The first Apgar doesn't even count. The second Apgar was 9. That's what every single baby in the world is that's healthy. So there was no distress.
And then
That's another thing. The baby's Apgars were fine.
And on page 32, it says baby's need for continuous cardiorespiratory monitoring, respiratory support, and intravenous fluids. Like, I feel like they were trying to make her look ill as soon as I started waking up after my surgery, because I was paralyzed for a few days. And as soon as I started becoming conscious, I go tell my family, go check on the baby, and then all of a sudden they put oxygen on her. All of a sudden they started attaching things to her and acting like she was sick, and she had been
That's
with
because
no.
They do that on every baby. They do that on a lot of babies. That's just, they do that. They just do that. But so I'm saying it wasn't like necessarily conspiracy, because they do that to all the other babies too. When they're C-section, they're just like quick to put shit on, and then they'll take it off when they prove they don't need it. And that's what their safety mechanism is. But it does say that on this page that you're saying me, page 32, where it talks about the system respiratory, it's because the assessment of the current problem and what they're going to do, the diagnoses they gave the baby, they say meconium aspiration, okay, but then when you go down to the lung section, which is the rest part that's highlighted, it says all she's on is a nasal cannula, and they're weaning her like a lot, like all the time. Like, she's basically fine, and just as monitor her.
Right, and
they're weaning it down every 5% every time. So basically the baby's breathing its own room air on its own, and they're just slowly taking it off because they're always cautious, not because she needed it. But the baby was fine, because a baby with meconium aspiration is being held on a respirator until its lungs heal. So that's not a correct diagnosis.
And what about the fact that she was on no oxygen for 2 days until, how did she go from no oxygen to all of a sudden needing oxygen? And then you know what I mean? Like, it seemed weird.
Well, she could desaturate and stuff, but that probably is because she's not with her mom. That's because she's not breastfeeding, and she's not being held and rubbed and all the things that normal interactions have, you know? So she was just doing her baby thing and suffering because they took her away from you.
Oh my God. And I've breastfed all my children. And
Yeah.
it's the most important bonding time a baby needs with the mom, and vice versa.
Yeah.
Like, that's exactly what moms need to be doing whenever they have their baby, because that is
Exactly.
very
We've
important.
been having babies since the beginning of time, and some people just know how to do it. And we've been trying to take that knowledge away from women. And anyway, this note was written on 7/11. So the day after the baby was born and put in the NICU, basically 7/10 is when they started. The baby was taken off oxygen. This is not evidence of meconium aspiration. They should have deleted that diagnosis.
Wow.
Yeah. Okay, let me say some other really quick things.
Okay.
I wrote them down for you, and I'll email them to you if I can't finish them. But so basically, your Fourth Amendment rights were taken because there was a liberty interest at stake, which is your right to care for your own family and your right to keep your family intact, to family integrity. Okay, so that was your Fourth Amendment right. And the whole threat of that you were the biggest risk to this child is not true, because the biggest risk to this child was that hospital, and to you was that hospital, because of all the things that came out from the delivery. They would not have been there were it not for the hospital. But the hospital has this hilarious self-aggrandizing arrogance that they did so much, and thank God they did it, because your baby and you would have died if they didn't do those things. But guess what? None of those would have happened if they weren't there. But they had no way to look at themselves that way. There's just no functioning body to say, hey, stop, you're wrong. Okay?
Right. Like,
yeah, exactly.
I've had all healthy vaginal births, and there was never any sign that something was going to go wrong.
Yeah, and let me tell you, my practice, as well as another physician in midwifery type care model out of hospital 11 years, he's never had to transfer a mom with a breech baby because she couldn't deliver it in 11 years. Because every mom that comes into care that has had a baby before has delivered that baby vaginally fine. Zero problems. The one death in a baby he had was for a head down baby that came out with no problem. So what I'm saying is that breech position had nothing to do with your ability to deliver this baby, the safety of this baby, or the outcome that happened as a result of the cesarean section, because there was unknowledgeable physicians in charge that were not questioned by a CPS worker.
Yeah.
Yeah.
And I mean, I don't. It's hard to imagine that they say these things on a medical record and they have no lab or anything that shows that that diagnosis has any valid anything to it, and use it as a allegation against me as a parent. And I'm not even a doctor, but they can't even back up one of their allegations with a blood test or lab test or x-ray that shows anything ever even happened.
Oh, also, I love the sentence that the CPS worker put at the end of her report. She said that the baby, let's see, where does it say this? It says that at the end result, it says, anyway, you'll probably find it better because my notes look teeny tiny to my little eyes right now. But it says something like the baby is happy in foster care. Did you see that sentence?
Yeah, like how? Yeah, like
no baby
I did not.
is happy in foster care. No baby is not crying and suffering away from its mother that it smelt and heard its heartbeat for 9 months.
When I found out she was still at the hospital, I went back up there to get her because my lawyers go get her. They have no right to her. There's nothing wrong with her. So I go to get her, and the hospital, I guess they call their risk management team, or their attorneys, and they refuse to keep her from me, but they stall me there for like 5 hours. And then they finally let me go with the baby, and CPS and the police attack me in the parking lot and corner me. And they didn't even have a car seat. They didn't have anything ready or able to take care of the baby. They just were hiding her, assuming like I thought she was gone already. So it blows my mind. They know that they're doing this, hiding a baby from her mother with no court order, with just a CPS allegation of something.
Yeah, that needs to be a law that needs to be changed. And I'm going to email you a podcast later that you can listen to and get more ideas, so you could use legal jargon when you talk to a lawyer, because you want to note this down, bullet it out, and make it super concise for a lawyer to review. Another thing is, so I already told you about the baby not having post-maturation syndrome. Choices to not intervene is absolutely within your right. Like I said, I have seen other mothers with twins and breeches refuse help, have their baby, and walk out the next day because it is your right to bodily autonomy, whatever the hell you want to do.
And the care for my child as well. Like, I don't want unnecessary procedures done on her either. My younger sister had Ehlers-Danlos syndrome, and they tried to, I guess, force treatments on her that did more damage to her than helped her. So we started.
Yeah, people need to open their eyes that the medical system, that the institution itself is not always right. And we've learned that over time and over history after mistakes are made, but we're within an era of that right now. And there is some precedent, so I'm going to send you a couple of cases that you could look at as a precedent to point to for your lawyer, okay? Not getting prenatal care is your choice. Let me see what else. I want to give you some quick bullets, and then I'll write.
I did my own lab work. I knew she was a girl. I knew her blood work.
Can you get your midwife records? Will she release them to you so that you can show that you had been seen or talked to somebody?
I used the DNA test from home, the at-home kit.
No, I'm saying your midwife records to show that you're doing stuff with a midwife. So it wasn't like you were avoiding all help. And even so, there's women that do free births, and that is absolutely within their right as well. But
Yes, I have
if you can get
the text messages and the blood pressure monitoring we were doing, and she was
good,
telling me, you know,
save
um,
all the, print those out, time and stamped and everything, so that you can show your interactions with another person.
okay.
And remember, 100% of multiparous mothers, such as you, have very normal outcomes vaginally. It's 100% in our practice, and we can get you all of those datas if you need them. Okay, you didn't have to have a C-section. 100%, you did not have to have a C-section.
Yeah, that's how. Had I known that was going to happen, I never would have went until after I delivered. I had no idea that that would be the reaction. I just wanted to be within, you know, a medical place or somebody that does have some medical training in case I pass out or in case, but never was I gonna be like, okay, cut me open instead of let me delivering my baby. Like, no way.
Right. And also, I'll have you watch the Nebraska midwife trial so you can see that even when a mother makes a decision to have a vaginal breech baby, and if there's a bad outcome for, uncontrolled reasons, which could happen in a C-section also, obviously it happened to you and the baby, but this midwife was the one that was in trouble, not the family, because the family was doing exactly what you did, was looking for a midwife to help them. So you did exactly what that family did, and the CPS never took away that woman's baby. There was no prosecution done. If they went to a prosecutor, that person decided to prosecute the midwife, not the mother, because it is her right to bodily autonomy. Okay, so I'll send you that case
Okay.
as well. And if I see any other statements, but is there any other specific questions about the records you want me to go about? Because I
Oh,
want to do that really quickly, but I gotta go because I have someone else in line.
okay. With the C-section and the complications that I suffered, was it directly because of whoever performed the surgery, or is that a normal complication that most people have C-sections go through that? Like, was
Most
I
people that go
abnormal?
through C-sections don't go through that. However, it's not because they did anything wrong, which is why they use standard procedures. They give you, and you have obviously a much higher increased rate of infection and blood loss when you have a C-section and you're in labor. Like, that is way more risky than a planned C-section where you're not in labor. So yeah, that's just a risk that happens, and it does happen to some women, and it's not because of the quality of the surgery. They did everything the same as they do for everyone else, but it's just that they didn't consider your life in this situation. They considered that baby's life, and that's wrong because you're the one that has to go home and raise your 4 other children, not that baby. Even if that baby died, it is your right to keep your life alive over that baby's. It just is. It
And
just
you
is.
can't take care of your baby if you're not alive to take care of your baby.
Exactly. Exactly. Any other questions specific to the care?
Um, so as far as the lab tests and X-rays, there's no actual data that suggests she anything was wrong, right?
No,
Like I
we had issues related to a cesarean section. Look it up. Go look it up.
yeah
That's
for the ability.
everything that happened is what happens to C-section babies.
Every complication that we had was due to the C-section, not due to
Not
any.
due to the breach. Not due to the breach. Not that would not have happened. None of the complications would have happened if they just let you push your baby out.
Yeah, like, and she was already there. Like,
Which
that's
is
what I.
why I think, like, I'm so mad at you for going. But yes, you did, and that's just what it is. But maybe you could be someone who helps the world by creating a precedent for this, for the medical model, because we need to re-educate them.
Yes, and I wasn't aware of midwives until I found out that I could not vaginally have my breech baby, and then my sister and my mom and everybody was helping me find alternatives and midwives, and it's and then we found out that it's the hospital policy. There are doctors that will deliver breech babies, just it cannot be done in the hospital. I never knew that, and that was just a horrible thing to find out last minute. And um, yes, that's unbearable. Like if they didn't, they didn't know any other health conditions. They didn't even ask. There's so many things that they didn't even consider before slicing me open. What if I had, my sister's condition? I may not survive the surgery. If I had other things wrong with me, then they didn't
Yeah, they
know or
were very
ask.
irresponsible in not getting a complete history, if that in fact is the truth.
Right. Like I,
Okay?
I can't believe how negligent they were to not even consider, um, you know,
Because all they're thinking about is what Dr. Stu says is the baby in the bassinet. Once the baby's in the bassinet, they can shake their hands off and go home. The rest of it, everyone else will deal with it.
okay. I appreciate your help so much. Is it is it okay if I print out a transcript or make a
Yep.
transcript? I'll send you whatever you need to so that it's approved by you before I hand it over to an attorney to
Or
look
just
at.
give him the recording.
Okay.
His transcriber will transcribe it, and that's legitimate because she is legally bound to do it correctly for the attorney. And I'll agree with that. That's fine, as long as a transcriber writes it.
Okay.
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 And then I will also give you any other, like I said, some homework for you to review, because there's a couple of things that can inspire you with ideas as well.
Oh, I appreciate it so much. I feel like that you and Allison and the whole midwife actually community has really made me feel like I'm not by myself
Yeah,
in
you
this.
just look
And
at brief videos at home, show it to your lawyer, and show him these babies freaking fall out. Like, that is the
yeah, the
idiocy.
midwives don't even touch them until
Yeah,
after they're out.
even if you need to touch them a little bit, like, they know when to, but the education of the physician has been so degraded when it comes to breech that it is a rare situation. And what they really should do is say, I'm sorry, I don't know how to deliver your baby breech. It's not that it's dangerous for you or the baby, it's just that I don't know how, and I should call someone in that could, so that you can have this birth without complicating your life or the baby.
Right, and never should that have been the only option. She should have told me a midwife exists. They're all alternative things
They
that,
don't do that. They don't want them to exist. So that's just not going to happen.
no,
But there are other physicians that are older that know how to deliver vaginal breaches, and they could have called someone in like that. And I'm sure that there was someone in the hospital that probably did.
yeah, I kind of feel like the lady that did the hearing test for the baby. I think that I don't think that they did that by accident. I think she wanted me to know that she was there. I don't know, just the tone in her
Yeah, there's
voice.
sometimes angels in the hospital like that. You're right. Okay, I gotta go. I
Okay,
got someone to see.
I
But
understand.
I'll email your stuff later, and please let me know what happens with your lawyer. I just want to make sure that someone's hearing you, because if they're not, I can find someone that will.
Okay, great. Thank you so much.
Okay.
We'll
Okay.
talk
Take
soon.
care.
Okay, thanks.
Bye.